Hello, today we will be discussing schizophrenia, particularly the symptoms and the treatments that have historically been used for this disorder and are currently used today. So, there are two major categories of symptoms of schizophrenia, the first being positive and the second being negative. As in the rest of psychology, positive indicates that there is something present that maybe should not be present, and negative indicates that something is absent that maybe should be present. Um, so the positive symptoms of schizophrenia include delusions and hallucinations, while the negative symptoms include um, a flat affect, so a lack of facial emotion, as well as social withdrawal, symptoms of depression, and anhedonia, which is an individual's inability to feel pleasure. So the positive symptoms are mostly caused by uh, an overconcentration of dopamine in the nucleus accumbens, while the negative symptoms are caused by a decreased level of dopamine within the prefrontal cortex. So, obviously, from the standpoint of treatment, this causes some issues because drugs for mental illnesses typically will target a neurotransmitter's concentration or the receptivity of those receptors throughout the entire brain. So, having a overly high concentration in one area and overly low in another area could be hard to treat. So the first way that this was targeted medicinally was in the 1950s with the creation of first-generation psychotics, particularly the antipsychotic called chlorpromazine. So this was fairly effective in targeting the positive symptoms of schizophrenia, but not very effective in targeting the negative symptoms. And additionally, it came with a number of side effects, including weight gain, sexual dysfunction, and Parkinsonism, which is essentially the presence of notable symptoms of Parkinson's in a patient who does not, in fact, have Parkinson's from a outside cause, resulting in lower levels of dopamine. And the second way that this has been targeted more recently, and some of this form of treatment is still present in schizophrenia treatment today, is second generation antipsychotics or atypical psychotics. So these drugs include dopamine stabilizers, particularly, which essentially work using a partial dopamine agonist. So what that means is that there are essentially this drug releases a partial agonist that can work within the nucleus accumbens to actually replace some of the dopamine at the receptors, because these receptors have a higher affinity for the partial agonist than they do for dopamine itself. And these agonists will only partially activate the receptors, so you'll actually see a decrease in those signals that would typically be present in the nucleus accumbens. And meanwhile, in the prefrontal cortex, we have that the partial agonist will act and partially activate some of those receptors where dopamine is actually missing from a scarcity of dopamine in that area. So that is where we are at currently medicinally with respect to schizophrenia, and hopefully progress will be made in the near future.